From psychiatry to system change, rethinking how we coordinate care. It's a big subject today. And what if our health system was truly built around people, not only paperwork? Today, we explore what better care could look like through the eyes of someone who's seen it all, from psychiatry to health system leadership. Welcome to Bipolar Talk, the podcast when we turn our bipolarity into an opportunity. I'm Gaurav Mishra, bipolar myself and founder of Upstage, and my guest today is Dr. Gaurav Mishra, psychiatrist, healthcare consultant, and chief medical officer of Mind Health Wellness. Gaurav's journey is about clinical work, leadership, and system innovation. They focus on how to improve cares and connect across board, like people who are taking care of like bipolar, for example. And I'm just going to let you present yourself, actually, Gaurav.
Yeah, thank you, Clement. Thanks for having me on your podcast. It's very nice to meet you. Again, I'm Gaurav Mishra. I'm a adult and child psychiatrist by training. I've been, I grew up in India, did my medical school there, and I done my psychiatry residency, child psychiatry fellowship here in the US. I also did my MBA in between, and kind of after my training, I've been working in very close to the US-Mexico border, actually, in rural areas, and then now in urban San Diego for the last 6.5 years. A lot of the reason I really ventured into health systems work is seeing a lot of the inefficiencies in our health system and the ways our health system is often designed. It doesn't help our patients as well as it could, but also it disadvantages our frontline caregivers, doctors and nurses and case managers, the whole team. So I really got interested in how can we do this better work. And the MBA was a way to have the healthcare leaders take me seriously when I wanted to talk about system redesign. And it also really educated me a lot about how to think of the problem more broadly. Because the training was amazing. My dream was to be a doctor, but medicine works on one patient, one diagnosis, one treatment at a time, whereas health system design looks at it more broadly, how to make the system better. And, over the last 6+ years now, I've been working very close to the US-Mexico border, very underserved area, but also very diverse. So worked on building programs for addiction medicine, co-occurring disorders for serious mental illness, including bipolar disorder and addiction medicine, working on maternal mental health programs with autism. So I've really enjoyed building health systems that obviously have to work for our patient, but I've seen it from the lens of let me make it work really well for our frontline team, give them all the resources and support so they can support our patients well. And that I've seen it work really well.
Yeah, at the end of the day, it's like if the team who helped the patient is not happy and trained and everything, it's like as bipolar, we're just going to be like disappointed. And
yeah,
and I think you explained it well. And I'm curious to have your opinion now on how to make the system better, because I feel the same as you. I feel it's a system problem. Mm-hmm. And every time we point, people are like, oh, it's because of this, it's because of psychiatrists, because of politics, but it's a system problem. So what do you do to make it better? And what do you do in a day-to-day basis? I'm curious, Bistro.
Right. I think one of the ways I've done it, by the way, made a lot of mistakes, and that's the only way you really try to do new things, is look at all the stakeholders, right? If you're looking at a system that's not working today, your stakeholders obviously are the patient, the kind of service they're getting, or the kind of service they should be getting and are not receiving today. But your stakeholders is also your frontline team of clinicians and the whole support team. But, the health system executives also have a different point of view of how to make things work, right? So oftentimes I see the frontline team may say, the executives don't get it. They don't see patients, right? The executives say the frontline doesn't get it. They don't know about the financial piece of it. the fact is both perspectives are critical. And I think the key is getting those two people together in the same room and finding common ground. I do believe the best possible care we can do is actually also financially sustainable. It's not the easiest path of doing things, for sure. So it is not easy to do, but it is doable. Because that's what we're here for, right? The reason we are in healthcare is because we want to make things better for our patients, for the people who come to get care. Yeah.
Yeah, and that's one of the big subjects. I think depending on the culture, it's something different. So I come from Paris in France, and for example, being financially viable is almost taboo. Is like people kind of be like, oh, okay, we're just spending money and it's normal. But and I can understand the ideology of saying like mental health should be free, everybody should have access to it. And it would be great. Let's be honest. Like, I will just sign out. And I always say that I would have been happy not to start Upstage because it meant that the system would have been great and my experience would have been great. So why create something to fix no problem? But yeah, so to go back about like, how do you make it financially viable? I think it's a tough question because, as you know, a lot of people need help, don't have the finance to do it.
Right.
So, what do you do, and how do you fix that?
It's a tough. By the way, if you had asked me in medical school, are you thinking about money in healthcare? I would have, like an idealist medical student, I would have said, that's such a bad topic. Let's not talk about money, right? That's a lot. And in some ways, that's not necessarily a bad kind of starting point. But yeah, it would be nice to have all of these great things of everything is free and everything is funded forever. But if you look at the reality, simple things, even the podcast, right? You have to pay for the platform. It's not free. You or somebody who you pay will have to edit the podcast. And so we are living in a world where the doctor needs to get paid. The case manager should get paid. The nurse should get paid. The building, all of that is a reality, right? And so it took me a while to understand, okay, I can think of the most ideal setting, not worried about money at all. But I also ran into a lot of problems where people say, this is not, we can't approve this. You want this for your patients or for your clinic. So the MBA actually did help me learn a little bit that, okay, you have to think of the start. If you're trying to do something, let's also talk about it being sustainable. Do you want to, do you want to start a company or a clinic which is doing amazing work above and beyond, but closes in a year because you've not thought about finances? Or you want to think about the finances so you're there for 20, 30 years in the community, serving the community, right? So I found that it's a tough pill to swallow, but I do think it is important. And for the clinical team also, the frontline team, to start thinking about this. If you want better solutions, to start thinking about not money first. We're not saying money first or patient first. I don't think that's it's a good comparison. It is obviously patient first. But how do you get there? If you want to fly to Paris tomorrow, you need a plane, right? So you need the tools to get there. So I think that's a little bit different way of thinking about it. And I think it's not, I don't think it's a compromise either. It's just thinking longer term a little bit, how to make this happen. Yeah.
Yeah, and I think it's an important conversation that we are not having in France. So I live in France most of my life. Now I live in Sydney, in Australia, since a few months. So I'm discovering a little bit like other system, like the US system. And I felt like, yeah, we kind of put it in like, is it good? Is it bad? Like, it's bad to make money. It's
right.
And I think you're right. Like, we have to make it sustainable. Otherwise, we just have to stop. And having this conversation with patient, for example, I know it's unpopular in France, but I think every patient should pay a certain amount when they go and see their psychiatrist, when they go to the hospital. I'm not saying 100% of the cost.
Right.
I'm just saying like a certain percentage.
Right.
Because if something, like in France, basically, being hospitalized is free.
Mm-hmm.
But if you want to, let's say, join or nonprofit, just as a member, you have to pay.
Right.
And it doesn't cost much. It's like $60. So for a year. And then you have a whole program and everything. But because you have to pay, because it has a cost for us, and we're doing a lot of volunteering, so that's why the cost is so low. But then people are like, oh, I shouldn't pay because it's supposed to be free. Because when they get hospitalized, it's free. It's not free. They're taxed. It's paid on one way or another. And now we have this system where you have like people believing everything should be free. And the level of the quality of free things is not where it's supposed to be, I would say. And on the other side, you have people like even nonprofit who are like, oh, we need to make people pay, even membership. And then it's tough because you have kind of free competition.
Right.
And we are in this system right now in France where it's really declining little by little. And you see the system collapsing.
Mm-hmm.
And instead of having this conversation about how do you make patient pay a little bit, I'm not saying 100%, but we are having this conversation about how you're bad because you make people pay for mental health. So it's an interesting conversation. And what is your point of view?
Yeah, I think I do think there will in all societies there'll always be a group of patients who are significantly under the poverty line or significantly financially disadvantaged, right? They deserve care as much as anybody else. I think I feel like the financial piece that I was talking about is a little more at this health system level. We are short-sighted in how we are spending the money, So we feel really good about the health system I'm talking about, feels really good about paying a doctor, paying a nurse, as we were talking about earlier. They don't feel so good about paying a peer support specialist, a case manager, care navigator, the human pieces of the health system, which really allow a patient to get care, right? So let's say I see a patient today we'll take bipolar disorder as an example, right? And I see them, I evaluate them, I recommend medication. And because I'm busy, maybe I'll see them in a month, right? Maybe month is generous, maybe 6 weeks, right? And in the between, I may have a couple, 2 or 3 therapy appointments scheduled for them, right? They may miss that. They may miss a couple appointments, right? And they don't show up for my follow-up visit. But this is in a system where I don't have enough support team members of case managers, care coordinators. But let's say I have a care coordinator who checks in with this patient once a week, 5 minutes, 3 minutes. It does not have to be, or if somebody's struggling, they check in for a few more minutes and let me know, doc, this patient is struggling. You need to see them sooner than 6 weeks. And then I do that. Whereas somebody else, oh yeah, he missed your appointment, but I spoke to him. He's taking all his meds. He's going to therapy. If you see him 2 weeks later, that's fine too, right? All of those interventions that have happened in the background have been done by somebody who's not clinically licensed or trained, but are so valuable in our health system. Versus, let's say we don't have that, right? This patient doesn't show up for 6 months, end up in the hospital because they're manic or hypomanic, right? They're off their meds. They may lose their housing, may lose their job. There is so much financial impact on this person, but also the health system in general, that if we think about it a little bit broader early, actually the health system will, I think, save money. Even though upfront it looks, oh, we're spending so much money on this worst person, but it actually saves money. So I think that is also like the financial innovation and planning piece that needs to be better.
Yeah, it's like I try to pass slow in France. So I know, but politician in the most, at least what I know, long term is difficult It's
Yeah.
difficult to be like, because, and it's no clear ROI. So because what we're saying is logical, and I think most people believe the same,
Right.
but it's hard to put on the data on just an Excel sheet and say, hey, you do this, you do that. In 2 years, the person is not going to be hospitalized, because in 2 years, it's already too far away, because the Ministry of Health will
Right.
stay for 1 year, maybe on average.
Mhm.
And yeah, and then you're saying something which is really interesting is like, how do you build a team around the person?
Right.
And the team, of course, you need a psychiatrist, I think. Like, that's probably one of the most important part, because most of the time I take my meds.
Right.
People need their meds, and I'm saying, like, I take it maybe 99% of the time. Sometimes I forget. What I mean is, I take my meds every day, and I'm lucky that I have a psychiatrist who can check on me.
Mhm.
But what happened is, it won't be there all the time. It's why I have a good helper, and and it became a friend. And you don't even need always to have it paying something.
Yeah.
It's like, there's someone who also have bipolar,
Right.
and we help each other, and we call each other once a week to check
Right.
on ourselves
Right.
and just be how you do it.
Yeah. Yeah.
But just doing that, so making this connection,
Mhm.
actually also costs money, but nobody will never invest this about how do you create a community, how do you match those people,
Right.
and it has to be think about an holistic way, I believe.
No, absolutely. I think it is also, I think if you think about patients who have more like complex lives, right? People who are homeless, or people who have kids and have very low income, unstable housing, right? So a lot of people, and US, I'm definitely seeing, I'm sure this problem exists across the world. There are many communities in which you're seeing people have very, very complex lives. People don't have enough childcare to come and see you, right? In COVID, we had people who were working 2 jobs to feed their family, right? So, there are many, many factors in their lives other than the illness or diagnosis itself, which is complicating being able to get care appropriately. And in those places, a peer is a lot more valuable than a psychiatrist, you know, because yes, your psychiatrist may call you, and if you don't answer, let's say you're busy, or your phone is not working anymore, they may try 4 or 5 times. But they're busy too, and they have other patients. There are many. So this is the person whose job it is to make sure you're connected human to human and are able to get that support. It is really critical to be able to have that as, I feel like case managers, care coordinators, peer, they're the backbone of any health system, because they are the ones who make sure patients actually connect to the provider.
And it's really to rethink the whole thing, because I don't know about what you think, but I feel like, so if we go back to think about us as patients, so
Mhm.
where we go and get diagnosed, what happened? And most of the time, we're like, okay, we have to build our system
Yeah.
ourselves.
Right.
Because the psychiatrist, he could be a great psychiatrist, but even if he's a great psychiatrist, maybe he's going to propose you to look and see about, I don't know, this company who can help, or this book, in the best case scenario.
Right.
but but then you have to figure it out yourself,
Yeah.
and it's like, and you're lost. And it's why I built Upstage, actually, is to be,
Mhm.
because like, I feel we shouldn't be lost. We should have like people who live the same thing to
Right.
help us, like, going stage by stage and just finding our path to stability.
Right.
And the psychiatrist is a key element. But if you don't do your talking group, if you don't stop alcohol, if you don't take your meds, if you don't, you know the old drill,
Yeah.
yeah, you're going to relapse. And that's just percentage. So how do you think, like, we can build this system
Mhm.
around clinics? Because that's something I tried to do in France, but it takes a lot of time.
Well, so I mean, system change, I think, and again, if you're talking about a country, the time scale is different. But even even in a single organization, the culture shift, change of culture work that I've done, this timeline of a culture change is at least 2 years, even at an organization. So it takes time. And one of the ways I think about it is I think there needs to be democratization of power in healthcare. Right now, in most health systems across the world, the power lies with the doctor and the health team and not with the patient. And so that is an imbalance of power. We need to create a system or work towards a system where the patient has more power, more say, and the support to, maybe some patients are not there that they can take full ownership of their care yet or be the lead, but we want to slowly get them to a place that they are the lead in their team. And a psychiatrist is just one of the members in their team. A therapist is one of the members. I think that shift. And, I think about Uber as an example. If you technology, how you went from cabs that you would call or you'd go to the bus stop, look for a cab, and you don't know for sure whether you're going to find a cab or they're going to show up. In Uber, the power went from the cab driver to the consumer, right? So I would think of a similar model in healthcare. The power needs to shift effectively to patients. One of the things what you're doing with Hope Stage, I think, is a way to do it, to build that network. So people who are early in their journey of understanding what is bipolar, what is illness, are more informed than somebody who does not have that resource. So, and I think you talked about, the family piece. I think, I talk to my patients. I work with kids and adults, and whenever I see kids, I see their parents are with them, and I'll tell you 50% or more of the mothers who bring the kids for evaluations have their own anxiety, depression issue that they've ignored for decades. And I tell them, even you getting care for yourself is a great example for your child to see. It's not a weakness, right? It's a great example for your child to see. I could struggle with something, and then there's help out there. I can go and access help. I think that's a good lesson. So, that's a reframing as a society. Also, we have got to do what better, more open conversations.
Quick break. Can you let us review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
Yeah, it's what I say also to families who has like someone who's bipolar. It's like just giving the example.
Yeah.
I know you want your son or to go and see a psychologist, but maybe you can go yourself, take care of yourself, go and see a psychologist, and then you can come back and just tell like what you did. And it's probably going to work much better than telling someone what to do.
Right. Definitely. Yeah.
So so I'm like going a little bit deeper into like building a system, because I think like you're the same as me. We think a lot about that.
And this is my favorite topic to talk about. So go as deep as you want.
I think it's one of my favorite too. So it's like, so right now you're doing stuff at Mind Health Wellness. Mm-hmm. So how did you build the system?
So I'm in early stages of my like a transition. So I've been an employee for 11 plus years as a doctor, I was the chief of behavioral health for a large federally funded healthcare organization in San Diego, which I was essentially I was seeing patients part of my time and building programs other part of the time. And so right now I'm out as a consultant trying to build my own consulting practice, which is a new business for me. So that's itself is a new challenge, and imposter syndrome and all of that. I'm working through it. So I know how to do the work, but I'm really focused on building, how do I present myself as a health systems leader to different organizations, right? One of the Mind Health Wellness is one of the organizations I work with part-time to do the same work in the LA region. And so my goal is essentially identify organizations who potentially have a need. Let's say the behavioral health program, it could be, and I see all ages, so it could be a child mental health program, adult, a geriatric, whatever it may be. If you look at a population that they're trying to serve, or let's say they already have a clinic, and a clinic may have a lot of inefficiencies in how they're running. There are not enough patients coming, or the patients are not showing up, or they cannot retain doctors and therapists and case managers. So my skill set is really talking to the front line, talking to the executives, really knowing, what are the real needs that the front line have, what are the needs the executives have, what are their goals. I can bring that both together to really make it so that the frontline understands that this is the reason why some of these decisions are being making. Executives understand the need of the frontline so that when they implement a new project, they can do it well. So again, my goal is to really work with different organizations to build their mental health programs. Yeah.
Yeah, it's a subject that is so interesting. And so, as bipolar, you're going through clinics, through an hospital. How do you know if it's the right organization for you? If you have the choice, sometimes you don't have the choice, but
Right.
it's like practical advice for a patient like me. Like,
Mhm. I think I would say the right organization is the one that allows you to ask all the questions you have and question what even the psychiatrist is telling you, right? So oftentimes, I've had this that patients will tell me, "Oh, I'm taking the medication," and then I realize 6 months later they're not actually taking the medicine, and we have this conversation that I tell them I'm not emotionally attached to the medicine at all. If it is not working for you, if it's causing side effects, I want you to tell me this is not working for me, right? So I think part of it is finding a place that you feel comfortable to question and ask why this medication and why not that medication, right? Or this schedule that you put me on, 4 medications 3 times a day, is just too much for me. Can we find something easier? So I think a little bit, to follow, because I was on antibiotics 2 weeks ago. It was a nightmare to take it at schedule. It's difficult, right? So, and are you prescribing me the newest medication on the market, which I cannot afford? Right. So all of these things are because the medicine has been so like top down for centuries that the doctor says and the patient listens. I think culturally, a lot of people still hesitate to speak up. And it doesn't have to be somebody who's rural. It could be somebody who has a great job. They may still be hesitant to speak up, right? So it's really, I think it's important to find a team where you can question and ask. You have your questions clarified. Maybe ask what is the thinking behind this, and really have those questions answered. And if it is not working for you to be able to speak up about it, so that's a lot of times that can be tough for patients, especially early on as they enter a health system. I also think if you have a primary care doctor or internist who you trust, that's a good person to ask, who is a good person in your network who would, because probably you have asked them questions and, who's a good person in your network who you would recommend. I would also start there if you don't know.
yeah, I think it's a great thing that I know it's tough because I've been there, and I remember because I was seeing a psychiatrist for I think a year and a half.
Mm-hmm.
And I kind of knew deeply that it wasn't a match for me.
Mm-hmm.
And it was tough. It was tough. And I remember one day I asked a friend, so I'm lucky because I have a friend who works in mental health, but so, can you recommend another psychiatrist? And I started seeing my new psychiatrist.
Mm-hmm.
And then I was I knew it was a match. And it was tough to tell, but I took the time, but it was really difficult to tell the old one, hey, I found a new psychiatrist. I won't continue with you. And
Right.
it's true, I didn't take the time to tell him why. And I wish I would have talked about it before with him. Because because he was the one who diagnosed me, so maybe I was a bit afraid, a bit scared of telling him hey, I'm not sure it's working for me with you.
Right.
What can we improve? And it takes a lot of courage. So if you're listening is like, yeah, I've been there, it's tough.
No, I think it's totally true. And I don't think that early, if you look at how healthcare culture is today, I do think the onus of making that discussion comfortable lies on the health system or the doctor, because yes, I mean, a lot of patients are struggling going from doctor to doctor, not being diagnosed appropriately, not being treated appropriately. So I do think it is a responsibility of the health system that a patient who's coming to you with so much vulnerability, right, is treated with the respect that they deserve for that vulnerability, right? I think it is critical. I do think mental health, the level of vulnerability you need to tell somebody, I'm depressed, I'm not feeling well, I'm anxious, is much more than telling somebody I broke my hand or my blood sugar is high. So the level of vulnerability is, I think, even more magnified within the health system. I do think, though, that full engagement, like both two parties communicating with each other, is so critical. Even me as a doctor, if I don't hear from the patient how they're doing, how it's working, are they sleeping well, all of that, if I don't get that input and I'm working in less information, then I'm not able to do my best job in that case. But then I do still think it is my responsibility to make that environment that I can be questioned, I can be asked, all of that.
Yeah, and I think we talk about it is like everybody has to do his part.
Yeah.
And of course, like what we do as Bipolar Talk is we try to do our part as bipolar, because the easiest things to change is yourself. And it's great to have conversation about how to change the system, but it's like, let's be honest, it's easier to change myself. It's easier for me to, for example, stop drinking alcohol because I know it helped about my stability. And of course, I can finding good psychiatrists or talking with my psychiatrist. So maybe it could be trained better, the system could be better, but how do I build a system that is right for me? And so it is about finding the good, like I would say, clinics, hospital, or even like organization that works for you. But it's also about building the systems that is right for you.
Right.
And the mental health organization can help you build the system. But how do you do it? And what do you think mental health organization can do to help the person build the system?
Yeah. I so I think I'll say, I think, just by the way, also just doing it for yourself is not that easy. Changing yourself is also not that easy. That's a tough road also, right? So I think I know I need to exercise, right? I have kids, I want to be healthy to take care of my boys. I don't have any internal desire to exercise though, right? So I know a few years ago I realized, okay, the drive is probably not going to come from within me. I got an instructor and that helps me stay on track, right? So that's a tool that I'm lucky to be able to use to be able to keep me on track. So I think some of it is also identifying what are your drivers, what are your, if there are other people who would find it a lot harder to give up alcohol than some others, right? And if maybe if that's a struggle, then all of us have struggles in our lives. I think we probably have to identify, these are the struggles I can manage on my own, and these are the struggles I need help managing, and then ask for the help, right? Sometimes navigating healthcare, especially early on, is very complicated. So a healthcare organization, maybe like yours, they can make some of the obvious questions, so you don't have to reinvent, right? So as an early on patient, you're trying to find out everything by yourselves and you feel alone. Is anybody giving me the right answers? So it's a lot of the, lot of that, those answers can be maybe pre-answered for you. If you go to an organization like yours where a patient is looking for answers, maybe that they can have a lot of the, how do I even know what does a psychiatrist do? Some patients have that question, so that definition, if I am feeling this way, what should I do next? Talk to your primary care doctor or get a psychiatry appointment, and I think even that piece is a lot of patients don't have that understanding of the health system or don't have that experience from other health needs that they have or family has. So I think even that is a great first place. I think so I tell, parents often that, if you don't know what your child is going through, sometimes it's difficult to know what's exactly happening. How alarmed should I be? You can start with talking to the teachers, a school counselor. You just start there. Just talk to the pediatrician, talk to the circle of people who are kind of in your care network to start with. I think that's a good place to start. If you don't have that, find a primary care doctor, and ask them. And I would say that's a good first step. And then you can start educating yourself. Yeah.
Yeah, and it's like what I found the toughest as bipolar is like you have this organization who can help you, but most organizations are not going to do the holistic things. So you will have to find like other things.
Yeah.
And as you say, like an instructor to help you to basically work out.
Right.
For me, is like I need a coach, which is a peer helper. I need a psychologist. I need a psychiatrist.
Yeah.
I need my mom and my girlfriend. And I have to be honest.
Yeah. I think
And
that honesty is a great first step, that I think even culturally, I do think maybe it's a little bit more for men, like being willing to even ask for help. It's not, in many cultures, it's not easy, right? To acknowledge that you need to ask for help. I was seeing my therapist and he would keep telling me that you have these 3 close friends and cousin. Why don't you talk to them about what you're experiencing? And it took me years before even me being in the field, being trained, could kind of say, okay, maybe I need to do this. And when I did, it was very helpful to even tap into your network. I think some people do have network but they don't use it, or they don't ask for help or talk to that network. Others don't, and then they have to build it.
and it will be surprised. Like every time I talk about my mental health with people, you'll be surprised how many of them are like just want to talk about it, but never someone had the courage to do it. And then they start opening up and, oh, actually, I was a little bit depressed. Oh, actually, my wife is, or whatever.
Yeah.
You'll be surprised, and it will probably help the person that you ask.
Yeah. I think no question. I think there's, for sure, every single person's life directly or through close friends and families is impacted by it. And everybody at some point goes through some kind of mental health difficulty. I'll say, finding partners is also something, maybe going back to the health system example. Even though the health system doesn't work well in many cases, even in the group of psychiatrists, and as you said, you found somebody who really worked well for you and aligned well. In many in hospitals or clinics, and professionals also who do think of the problem very similarly, as you're describing, like this is a problem in our system. And I think even finding system change can also happen when you, as a strong patient advocate, or is kind of reaching out and saying, like, we are aligned in how we look at this problem. What can we do together to bring more awareness? Kind of similar to what we are talking about today. Yeah.
Yeah. And it's like, and it will improve. I believe there's like, people are aware of the problem, but we have to fix it ourselves. And
Yeah.
I don't believe like magically some like politician are gonna come in and gonna fix everything.
Right.
It's about doing those little steps, being patient.
Right.
You explain that it takes 2 years for one organization to change. For someone to change, maybe it can take a bit less time, but it still take a lot of time.
Right.
And that's what I want you to hear is like, it's tough. It's like, it's not easy to have bipolar. It's not easy to be in a system that sometimes don't understand you or not adapted to your need. But if you have the courage and the willing to do the hard things, which is asking for help, is probably one of the hardest,
Absolutely.
and so many other things, but you will get there and you will find your way to stability and be happy and have a fulfilled life.
Mm.
And yeah, I wanted to share this message because I've been there and I've seen thousands of people have been there. And the problem is it's not going to take 1 week. It's not going to take 1 month. Maybe it will take years.
Yeah.
But if you keep going, you will get there.
Yeah, no, definitely. And I think, sometimes I'll hear patients say, oh, no, I can't do this right now. I'm taking care of my family. I'm taking care of this. It is really, even if your goal in life is to take care of others and help others, if you're not taking care of yourself and if you're not advocating for yourself, um, there will be a time that you're not going to be able to keep doing what you want to do. I also tell moms, especially, people are only going to respect you or your need as much as you respect it yourself. So if you don't stand up for your own, physical health need, mental health need, support that you need, if you don't ask for it yourself, do not expect others to think of it for you and do it for you, right? So it is really that it's a painful realization sometimes for people that you have to do it for yourself first, and nobody else has better interest in you getting better than you yourself.
Yeah, no, it's true, and it is what the word is today, and it's like it's individualism is one of the biggest things,
Yeah.
and there's beautiful like talk, but at the end of the day, yeah, if you don't care about yourself, nobody's going to do it. Like maybe some people will do it, and you will find a great psychiatrist, but it won't be enough. I have to say it. It's like you cannot like people think that just the right pills or the right psychiatrist or the right hospital is going to fix it. No, it's not. It's like you need a lot of different things, and you need to find and build your puzzle
Yeah.
and build your system. Because we're talking about the mental system as a whole, but you have to build your system, and everyone's system is different.
Yeah.
It's about like, what are your triggers? What is your pills? What do you need as psychiatrist? How do you talk about your problem with your family?
Right.
And yeah, you will get there. And I'm pretty hopeful. I'm someone who is kind of positive, and because of what you're doing, also go out and changing organization, and but it will take time. So I'm seeing the time flies, and
Yeah.
I wanted to ask you this question: if you have a magic wand, what would you change in mental health?
By the way, let me just first say, I think your psychiatrist also needs their own system. So I think, everybody needs their system, right? To stay well, to stay healthy, to get care, all of that. I think magic wand, is, I would say, I think the health systems have gone very far away from the very human to human connection that is a very critical part of health. How you relate to your psychiatrist, how does your psychiatrist relate to you, and all the therapists, all of those pieces, the actual piece of human care, right, is probably one of the most powerful pieces of any healthcare intervention. I think, and that's not because people care less. I think that's because we have created systems which don't allow people to be their full human person interacting with another human, right? And so I think my wish would be that we can work on, and I think the only way to do this is work on system redesign a little bit to really get to a place that, when you see your psychiatrist, see your therapist, see your peer support, they are able to give you 100% of their attention and be with you and understand where you're coming, hear you out, and get that one interaction in that moment is so critical. And if you can replicate that across the health system, I think that fixes so many problems. That helps prevention, that helps ongoing care, that helps, whether do I feel comfortable talking to my doctor about this medicine? It helps with all of those things. I really think we need to get back to being better at being human with each other in that health system space. Sometimes it becomes too mechanical because we have to get to our next patient and, that would be my hope.
Thanks a lot, Gaurav, for your time, and hope to see you soon, actually.
Great. Thanks, Kumar. It was great talking to you. It's a pleasure.
To learn more about Bipolarity, go to our website, upstage.com, HOPESTAGE.com. See you soon.